Well, one of the biggest learnings that we picked up from pandemic is the health infrastructure of the country. And who would have believed that there could have been some kind of major development seen at the India Mobile Congress 2022 in New Delhi? To talk more about this, we are joined by Mr. Madhur Bharadwaj, Head 5G Enterprises Solutions, Bharti Airtel. I'm in the Bharti Airtel 5G booth, and right behind me, Madhur, I think you will be the best person to talk about this, but right behind me is a mobile clinic van. Madhur, tell me, what is this? And I'll also ask my cameraman to pan the details for you to explain it to us.
Sure. Thank you so much. Look, 5G is a great enabler in terms of technology and its larger impact on society with respect to what kind of use cases it brings for different industries. So one of the industry verticals that we are addressing using 5G is healthcare. Now, India is a country of very diverse and complex demography, and people in far-flung areas, rural areas, are having hard time sometimes to have access to primary healthcare services because of the complexity in terms of demography that I talked about. So the reach to the hospital is sometimes running into multiple of kilometers. So that way, we thought, is there a way we can extend the hospital to reach out to these villages? Can we extend at least some form, at least the primary healthcare services in terms of diagnostics, test cases, and some basic parameters, where a small vehicle like this can be converted into a mini ambulance, and it can carry some kits for basic tests and diagnosis. And this AmbuPod comes up with around 55-60 different kind of tests that it can carry. It will have an access in terms of extension towards technology and connectivity towards a 5G layer, which will further connect the endpoint to a doctor. So that way, doctor can interact live with the patient who comes in vicinity of this ambulance and the primary healthcare person sitting here. And then he can be diagnosed for various diseases and can be recommended some tests which can be carried in real time in that moment itself, and the report for the same can be uploaded to the doctor within minutes. And so this really helps, first of all, the extension of the reach of healthcare services to the villages. One AmbuPod can cover 5 to 7 villages in a single day, and connectivity wise it will have a more reliable and high bandwidth connectivity of 5G to really solve this problem of a constant interaction need. So that way we think that this is going to solve a lot of problem for those areas, and this can be very beneficial for the people in rural areas as well.
That's great to know. Madhur, would you tell us that, we of course know that certain kind of mobile vans already exist and they could be running on the 4G technology. How long will it take for us to get those resources set up in the rural areas for 5G?
So in terms of time extension, I think that's a question that everyone is interested in understanding, what time my geography or area will get covered up. So I think the rollout has started already, and in next few months to maybe a quarter, 2 quarter, 3 quarter, you will see a very progressive way of getting this network extended to these areas and reach. So, and you today heard about the announcements of 5G going live. So from here on, I think it's with all of the operators who would be interested in extending these services to all these areas, because that makes a lot of sense for laying the base layer for connectivity and the high bandwidth for extension of such kind of use cases. So very soon, I think you will start seeing this happening, and across multiple quarters now, you will see this extension of 5G network happening.
I see that there is a mini camera there. Is that where, the doctor connects from?
Yeah, so there is a camera in this, and there is a connectivity layer. You can do a video call, and a person and a doctor can interact with the patient live, and then based on some basic diagnostic can help him with the medicine. The van carries the basic medicines also. So that way, I think it can really be of great use. It is a very good instrument in terms of handling the situations like pandemic, situations like vaccination drives, etc. And that way, I think hospitals would be looking forward to these kind of solutions for extension of their primary healthcare services to a greater reach.
Okay, that's great. In fact, this is coming at a time when Prime Minister Narendra Modi has been talking about digital India, and the investment in health sector when seen from a digital aspect is also big. Thank you so much, Madhur, for joining us. We wish Bharti Airtel all the luck for this mega cause that we are looking at.
Thank you so much. Thanks.
If you like the video, do like, comment, share and subscribe.